We can do better.
Powerful words for doctors from 58-year-old cancer patient Marty. In the summer of 2008, this skilled carpenter from mid-Missouri received his diagnosis, delivered with an alarming lack of sensitivity.
She threw up her arms and she said, "This is the worst case of rectal cancer I've ever seen." I said, "Can you help me?" "I don't know." And she kind of escorted me to the door, and then I was supposed to go down to a receptionist and fill out some paperwork to have a portacath put in and some other things. And I was so shook up. She said, "You're going to have to wear a bag." That I left the place, I mean, I was like shaking.
Marty, who calls himself well-educated, found himself drowning in a scary sea of medical jargon.
When you say resect my liver, what does that mean? Take it out, throw it away, transplant it, cut it up?
Health literacy is defined as the degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate decisions. Studies show a lack of health literacy costs the state of Missouri an estimated $3.3 to $7.3 billion each year. This is why the Missouri Foundation for Health has launched Health Literacy Missouri to improve the health status of Missourians and become a national leader.
What we've been able to create is really more of a group genius, recognizing that bringing the expertise of all these different centers throughout the state, we've been able to tackle the problem of health literacy in a way that heretofore people probably have not attempted to do.
We're on the verge of doing something very unique in this country in healthcare. And everything we've heard from the President and from the Congress suggests something is actually going to happen this time. If we put a lot more money into a system that people don't understand, or if we bring people into the system and they don't understand what they're being told, they can't read the it's not going to improve anything.
Experts say health literacy needs to be the cornerstone of healthcare reform because right now estimates show low health literacy costs our nation's economy as much as $238 billion per year.
A lack of health literacy costs you in so many ways. We can measure it in a business case and show that there are hundreds and hundreds of millions of dollars that are lost in a given environment because people are health literate and can't act appropriately, don't understand how to take medication, don't understand what they need to do to stay healthy. But how do you quantify the human cost, the pain, the suffering, the family that suffers as well, the missed opportunities, the time lost from work?
The majority of Americans read at a 6th to 8th grade level, and communicating in plain language can go a long way toward promoting understanding. Dr. Ingrid Taylor has made health literacy the mission of her inner-city practice in St. Louis.
The provider needs to look at body language. Does it look like the patient understands? Does it look like the patient is kind of scared?
To empower her patients, Dr. Taylor developed a workbook called My Health Companion for patients to write down and access information to help navigate the office visit. Just watch how having this small red book electrifies this group of patients.
But I think it's very important that physicians understand, because you're the physician doesn't mean that you get to talk over me or discount my concerns.
I'm not an organized person at all, God knows. I don't write stuff down, but since I've had the book, I find myself writing stuff down in the book. I had a few little chest pains last night, so I wrote that down.
Missouri Foundation for Health funds the Health Companion program, and demand for the workbooks is skyrocketing. This health empowerment program is one of 19 demonstration projects underway around the state. For Health Literacy Missouri, it's about rethinking health education starting in elementary school all the way to future doctors and medical schools.
We have really taken as our approach to look at the systematic change in health literacy. By that I mean a hospital and the signage involved in a hospital. So you go to a hospital today, and for anybody it's confusing to try to find where it is you might need to have your x-ray taken. So just think of it if English is a second language, or if you don't speak English at all.
So considering the average American and their reading level, look closely at a prescription bottle. Nowhere does it talk about what could be deadly drug interactions.
Struggled with reading all my life.
Brochures, hospital signs, all can be confusing when you don't read well.
A friend of mine, he's a new reader from California, and he went to a doctor's office, and they sent him back to go to the x-ray room and get an x-ray, and he walked and he was looking for the signs at X-ray and he couldn't find it, and he didn't want to ask anybody, so he walked out the back door because he was too embarrassed to ask.
High blood pressure, but I've had 2 episodes of pancreatitis, didn't know what that was, and then I, in 1999, also had an episode of renal failure and kidney failure.
Jerry Hodges knows understanding his conditions is key to staying healthy, and it isn't easy.
Especially the medical terms. They throw a medical term at you and you go, what is that?
Health Literacy Missouri feels strongly a reworked healthcare system needs to be spelled out in plain language to ensure better health for all.
If you don't follow a health plan, your chronic illness just festers and gets bigger. So that by the time you present to the emergency room, you're looking at a 3, 4, 5-fold problem.
So it's easy to see how costs add up. Think about this. According to the Institutes of Medicine, as many as 90 million Americans lack the skills needed to function in the healthcare system. As a master carpenter, detail is Marty's job, but he feels the doctors who treated him for rectal cancer dropped the ball when it came to the detail.
Well, I figured I was going to die. This was all preventable. Everything I went through would have been preventable. And maybe I should have been more aggressive, or maybe I should have questioned, but I thought they knew.
For Marty, medical missteps nearly cost him his life. This past spring, he was well enough to walk his daughter down the aisle at her wedding. Still, he wonders about how healthy he could be if the cancer had been caught earlier, if the doctors had been better communicators.
It's cost me a year of my making a living. I'm still seeing a wound care specialist, and the co-pays are $100 every Friday.
For Marty, his medical bills cost the insurance company as much as $500,000. He is one case, an example of how health literacy can unravel. Health officials in Missouri are facing the problem head-on and hoping now that Washington listens.
It is a big deal, but if we play just off the cost card, we're going to miss the point that what we really should be looking at is the human loss in this, and the misery, and the bad health outcomes and so forth. That's the important part.